An abridged introduction to how pathological demand avoidance in brackets PDA profile of autism seems to be a constructed category by Richard Woods at London Southbank University, PhD student. So, I do have a few conflicts of interest, so I'm developing a few tools around PDA, such as the pathological demand avoidance belief scale. I do earn some income from delivering training sessions on PDA, and I reluctantly advocate for PDA to be diagnosed as a standalone construct. A bit more about my perspective and biases on the topic. I am diagnosed as autistic in 2012. I do meet Elizabeth Newson's PDA profile, but I am not emotionally attached to it. Presently, I am no longer basing my identity on diagnostic categories as much as I can do. Um, and I am equally respecting divergent views and evidence on PDA to critically synthesize appropriate interpretations on PDA. My PhD is investigating PDA as part of the Critical Autism Studies/Disability Studies group at London Southbank University. This is my interpretation of PDA and its literatures. Others may disagree with aspects of it. I may sometimes use medical model-based language, but that's because I'm just reflecting the source material, not that I am necessarily agree with it. So yeah, I intrinsically recognise that. I recognise that intrinsically the psychiatric categories are social constructs. So moving on, this is an abridged introduction to the topic. So this video I'm aiming to be about 20-25 minutes. The original one's about 40 minutes, hence I'm doing an abridged. Um, and this video is part of my ongoing video series discussing my thoughts on PDA in 2003 series. Um, so yeah, the video will cover the PDA features continua diagram, how PDA Profile of ASD is being socially constructed, particularly covering three examples, so like the socially manipulative to strategic avoidance trait change, autism and social communication categories history, and then autism, anxiety, and PDA, and then just ending on some reflective questions. So yeah, this is the current diagram I'm using in my work to conceptualize PDA. Um, but please don't verify it's got some issues when you kind of think about it in practice. So yeah, on the what it does, it shows a series of features as a series of continua that are meant to exist within the autistic population. So on the left-hand side of these continua, you have what some would call a PDA profile of autism. On the right-hand side, you would have kind of classic or more straightforward autism. Um, and there's other ways of looking at it, because I would just say the right-hand side is just mainly autism, and the left-hand side seems to represent features of ADHD, anxiety, conduct disorder, oppositional defiant disorder, and trauma-related features. So you'll notice that these continua are represented in a series of red arrows and green arrows, with the red arrow is meant to be more impaired or more problematic, and the green end is meant to be kind of less of an issue, less impaired. So these features include kind of anxiety, avoidance of ordinary demands like bullying, harassment, lying, stalking, and other kind of criminal behaviours, fantasy role play, kind of impulsivity, associative behaviour, which is often focused on other people, a kind of a need for control or a drive for autonomy, rapid mood changes, and reinforcement-based approaches such as applied behaviour analysis or positive behaviour support. Um, what I mean by that is basically how effective they are. Are they meant to be effective with that kind of population? And this is kind of one of the reasons why this diagram is a bit problematic, because the PDA literature would suggest that that reinforcement-based approaches are ineffective and can cause distress in PDA, but for autism it's meant to be kind of like effective and gold standard. So yeah, the final two continua is that theory of mind and socio-strategic and manipulative avoidance behaviours. So moving on, yeah, we know from the autism literature that how the category of autism spectrum disorder in DSM-5 is constructed is that there's a bias towards white males, um, and this bias tends to be a result from methodological bias resulting from the inclusion of predominantly male samples, as well as the use of clinical tools designed to fit the male autism presentation. So yeah, there's a stereotype that autism is a boys' disorder, and that and we know that from the literature that males are many times more likely to be referred than females for an autism assessment. and that when autism features are at comparable levels, females are less likely to be attributed with autism than males are. So yeah, so autistic females are often being diagnosed later than males and are often misdiagnosed. So there's there's a there's a problem. So when you kind of consider these kind of factors for there being a male bias in autism, there seems to be a bias towards diagnosing PDA in autistic people or suspected autistic people. Um, so yeah, and so we seem to note that. So this is quoting a 2016 B page 2. So it should be noted that so far we have approached this profile from the starting point of our expertise in autism. Um, I'm going to move on to a quote from the PDA Society from a document. It claims to be clinical guidance. I just think it's a highly biased research report, but I'm going to move on to the quote. So, as a result of this broadening of the way that autism and the autism spectrum is seen, the contributor's view is that PDA is currently best understood as a profile, or in brackets, a cluster of traits on the autism spectrum. And so far, like prevalence for PDA has been seen and kind of investigated in autistic persons, and like often key pieces of research are investigating PDA in suspected autistic samples, such as exploring PDA's behaviour profile in suspected autistic persons in like Eaton and Weaver 2020. So also like prominent PDA tools such as screening tools and semi-structured interviews are often kind of at least initially validated in suspected autistic persons. So that's the extreme demand avoidance questionnaire. That's a shortened version of the extreme demand of the extreme demand avoidance questionnaire. So it's just like an eight item version. And the 11 revised PDA Disco item. So the Disco is the semi-structured interview created by the National Autistic Society to assess for autism, and it has 11 revised PDA questions because they originally had 17. So yeah, I mean, in the study which initially validated 11 revised PDA Disco questions, they assumed that PDA was seen in less than 30% of their sample because they wanted to make PDA a meaningful subgroup of autism, which is problematic in my view. And also this is another quote going back to this document by the PDA site, which it claims to be clinical guidance. So within their autism diagnosis, there's a range of terminology that is used in formulations, including autism with PDA profile slash pathological demand avoidance profile, demand avoidance profile slash a profile of demand avoidance, or extreme slash pervasive demand avoidance. So that's from page 20. So what they're saying here is that it's a dual autism plus PDA diagnosis, which I have issues with. So yeah, this is problematic because we know that PDA descriptions have changed away from. So we know that Elizabeth Newton's PDA behaviour profile has many aspects of it which are not indicative of autism, and that's because the literature at the time, from around 10 years ago, from going up into around 2015-16, was very clear that it's difficult to view PDA as a part of the autism spectrum. But if one looks at recent PDA traits and how they're wording in the PDA profile, they have changed to become autism-like. So, for example, we know that the manipulative behaviours are not indicative of autism, but if you look over time, they have changed to take on autism-like features. So, if you look at the strategies of avoidance are essentially socially manipulative, from Newton Tale, page 597. Over time, they've changed to for the manipulative aspects, which indicate that it's not autism, have changed to become strategic. So strategies of avoidance that are essentially social manipulative, and the social manipulative is in quotation marks to indicate that it's not socially manipulative. So that's from an Owens et al. 2016A, page 415, is then changed to uses social strategies as part of avoidance, e.g. distracting and giving excuses. So yeah, just a moment. So where does this strategic avoidance behaviour come from? Like, why has this manipulative strategies changed to become strategic? So the first research which seems to suggest that PDA social avoidance behaviours are strategic is from a 2018. So this is a problematic because a nice 2018 A study is a replication study of a nice 2015. Um, so what a nice 2015 is, it's got about 14 trillion persons in there, and I think off the top of it asked the caregivers to kind of respond to 22 item semi-structured interview. Um, and it's interesting because the United 2015 um, cases has one non-autistic person with PDA in there, um, while the 2018 version of the study has caregiver interviews of 22 autistic persons that are suspected of having PDA, and it has a matched um, so it has matched demographic samples, so the gender ratio is the same. But the key difference between the two studies is that both 2015 version and 2018 version both used the same 22 items restricted interview, but in the 2018 one, the second one, they coded the interview data with the 11 revised PDA disco items, and that matters because the one of the items of these 11 PDA disco questions is apparently manipulative behaviour. So if you're coding your interview data with apparently manipulative term in there, your manipulative behaviour can't be manipulative, it has to be something else, so you have to call it something else. So that's why you kind of get the change to strategic. So the strategic behaviour, the term strategic is in there due to the methodology used in the 2018 paper, and it matters because the previous study viewed the social avoidance behaviours to be manipulative. And just quoting the abstract from the 2015 paper, it says that examples suggest social insight sufficient to use targeted social manipulation. And that's reflective of the literature at the time, going around from 2015, 2016ish and before, is that PDA has intact theory of mind or relatively intact theory of mind, and social avoidance behaviours are manipulative. So yeah, I'm going to move on to the next example. So, as a result of the broadening of the way that autism and the autism spectrum are seen, the contributed view is that PDA is currently best understood as a profile or cluster of traits in brackets on the autism spectrum, from page 3 of this PDA Society report, which it claims to be clinical guidance. So, yeah, I would argue that the autism spectrum has not expanded to include PDA. I would argue that some PDA features may be considered to be part of autism, but I would argue that most are not. So yeah, so this is a diagram from Newson 2003, page 599, and it shows Newson's thinking on what the autism spectrum is and how PDA may relate to it as part of Newson's pervasive mental disorders diagram. The first thing you'll notice is that this diagram is not reflective of the DSM-4 pervasive mental disorders diagram, which diagnostic group. And so if you're familiar with the diagnostic manuals and the version that was in use 20, 30 years ago when Newton was doing this research, the autism spectrum was a subpart of the pervasive mental disorders diagnostic grouping, which had in there childhood disintegrated disorder, Rett syndrome, Asperger's syndrome, autistic disorder, and pervasive mental disorder not otherwise specified. And the last three were the autism spectrums. That was Asperger's syndrome, autistic disorder, and pervasive mental disorder not otherwise specified. And that does not match up with this diagram at all. So Newson viewed the autism spectrum to be Asperger's syndrome and autistic disorder. It quite clearly is based on a triad of impairment, so it has fear of mind issue and empathy issues. But this diagram has specific language impairment, which includes categories such as dyslexia and dysphagia. And that's important because Newton views this diagram to have coding issues, so that's difficulties understanding aspects of communication. So that can be either kind of writing or speaking, or kind of understanding issues of kind of social communication, because PDA is meant to have intact or relatively intact theory of mind, but social communication issues are meant to be due to deficits in understanding social identity, pride, or shame. So Newton viewed PDA people just not understanding, complying with theory of complying with demands. At least if you read it, their work and especially the 2003 article anyway. And Newton's quite clear that they're meant to have social manipulation. They're meant to have the interactive reminder. It's also quite clear that Newton viewed PDA to not be based on triad of impairment because triad of impairment here, no triad of impairment here. So it's also important is that specific language impairment is quite prevalent within the human population. It's seen between 3 to 7% of the population. So there's a lot of non-autistic persons in this diagnostic grouping. It makes it problematic to. What it means is that Newton's pervasive mental disorder grouping is not the same as the DSM-4 one, and it matters because the PDA Society quote I just gave you assumes that that with the pervasive mental disorders being replaced within the DSM-5 within the neurodevelopmental disorders chapter, there is autism spectrum disorder diagnosis and the residual category of social communication disorder. But they are assuming that with that change that PDA falls under falls within the single autism category. I'd say this is problematic because the change is not applicable because the DSM-4 categories are not equivalent to nuisance categories, and that PDA doesn't come into it because it's not based on triad of impairment. It contains non-autism features, quite a few of them, and Newton viewed people to PDA to be non-autistic as well, which I would say I I do not think people can assume a person's autistic due to having PDA. I think that's a quite fair and reasonable conclusion. But I'm going to move on. So yeah, historically, many categories with social communication issues and restricted repressive behaviours and interests were proposed, such as kind of being either subtypes of childhood schizophrenia or as a standalone categories. So historically, going back 100 or so years, these kind of categories with social communication issues and restricted repressive behaviours and interests were formed as a form of childhood psychosis. So that included predominantly childhood schizophrenia, which was the predominant category at the time, and it had subtypes, and people can transition between subtypes. But childhood schizophrenia is now a dead category. It stopped being used around the 1980s, and it kind of matters because Newton started collecting her sample in 1970s when childhood schizophrenia was being used. But yeah, so more recently, with the change of the DSM-5, as I said previously, there's a single kind of autism category and a residual category of social communication disorder. But the problem is the social communication disorder seems to be not often used. So this matters because the DSM the categories within the psychiatric manual, the American one, they work on the assumption that most people do not fit neatly into these categories. So so often there will be residual categories that basically just hoover up and mop up those who don't meet threshold for the categories. So and then the DSM-5, it's for autism, it's social communication disorder. It seems not to be used well. In the DSM-4, the residual category for autism was pervasive mental disorder not otherwise specified, and that was quite commonly used. So it was used when people were not meeting threshold for either Asperger's syndrome or autistic disorder. And the DSM-5 states that the pervasive mental disorder not otherwise specified was the most commonly diagnosed, attributed DSM for autism subtype. So yeah, it's problematic because the present DSM-5 autism criteria are not designed to create autism subtypes. They're not designed with PDA in mind because PDA is not included in the diagnostic in the DSM-5. So we're kind of in a typical time because we've basically got a single category being used for people with social communication issues and restrictive and repressive behaviours and interests, when historically there have been many versions of them and with residual categories being used, and we aren't we're in an atypical time basically in how these categories are being used for social communication issues and categories with restrictive behaviours and interests. I would point out that the PDA literature contains sufficient examples of people being attributed with PDA as a standalone category that PDO can be attributed as a standalone category if one wants to. So if one accepts the underlying assumptions of PDA Profile of Autism, it would intrinsically be a neurodevelopmental category. So that means that it can be attributed as a standalone neurodevelopmental category if one wants to, and that it's a choice to view PDA as a profile of autism. Um, so yeah, often PDA profile autism advocates would say that essential impairment is meant to be anxiety, and it's anxiety that causes most, if not all, of this demand avoidance. I have a problem with this because quite clearly anxiety is not is autism has not expanded to include anxiety as a feature, and I'll kind of discuss this. So yeah, the literature notes that PDA behaviours may not be caused by autism, so it might be a double hit, so that PDA may not be caused by autism, but by, for example, hyperactivity and conduct problems, and or hyperactivity, conduct problems, and anxiety. So there is some empirical evidence to suggest that. Another study has indicated that PDA may be a triple hit of autism, anxiety, and conduct problems. A more recent study, for example, has included that PDA may be caused by both autistic traits and anxiety, were unique and equally important predictors of autism demand avoidance. And there's other studies that are applicable, kind of giving similar results that are indicating that PDA is caused by multiple things, not just autism, or if not, or PDA may not be caused by autism at all. And this kind of matters because if autism has expanded to include PDA features, you wouldn't be seeing these results. You'd just be seeing PDA is predicted by autism. So, for example, if you take the whiter tail results, you wouldn't be saying PDA is predicted by both autism or autistic traits and anxiety, and both are unique and equally important predictors. You'd just be saying PDA is seen by 100% is just predicted by 100% autism. So the fact that these results are being said tells us that autism has not expanded to include PDA features. But there's also a basic logic issue. A plus B plus C does not equal A. So if PDA is caused or represented of featured by multiple categories, it cannot be something it is more than. It cannot be autism if it's also being caused by anxiety, conduct problems, or hyperactivity and other stuff. More practically than that, the DSM-5 itself, which apparently says that PDA, I'm going to say focus. So the DSM-5 itself views anxiety to be a co-occurring issue, a co-occurring difficulty for autism. More recently, proponents of another proposed autism subtype, which is called profound autism, they have proposed creating autism subtypes based on using co-occurring difficulties to create autism subtypes, and they've deliberately kind of suggested using anxiety to kind of create an autism subtype. I should point out that profound autism itself is constructed using co-occurring difficulties, so it's meant to be attributed with those who have either intellectual disability and or in language impairment. So, yeah, categories within the DSM, the categories that are within the DSM-5, they're only designed to map onto narrow segments of people's spiky profiles. So these categories are not designed to be used to create groups such as PDA Profile of Autism, or even to create profound autism, which is meant to have multiple kind of categories lumped together to create it. So what it means is that autism has not expanded to include anxiety. It cannot. Well, we know that autism has not expanded to include anxiety if it's been actually debated if autism should be expanded to include anxiety. Because if autism had expanded to include anxiety, we would not be debating if it should be expanded to include it. So yeah, I mean, I'll revisit autism anxiety in a later video because I have massive problems with trying to make anxiety an autism feature. It has a lot of knock-on effects which are not good. So yeah, I'm going to end with some reflective questions. So yeah, are there examples indicating that PDA Profile of Autism? Are there other examples indicating that PDA Profile of Autism is constructed, and why? Is PDA Profile of Autism a rare autism subgroup? And before or after a 9 2016A is seen PDA is an autism subgroup, and arbitrarily decided PDA is seen in less than 30% of autistics, and why? Has autism expanded to include PDA features in part or in its entirety, and why? Can one assume a person is autistic due to being attributed with PDA, and why? If one accepts most assumptions underpinning a PDA profile of autism, can PDA be attributed as a standalone neurodevelopmental category, and why? And how should one conceptualize and clinically attribute PDA during the 2010s, and why? So, yeah, these are my contact information. So this is my email address, my Twitter handle, my ResearchGate link, which has most of my kind of conference talks and publications and stuff. And yeah, so there's 4 reference sites for this video. I'm not going to linger on them loads because you can pause them to get the references. The full text of the previous version of this video will be available in the video description if you want to go and access it. So yeah, if you want to kind of see these points discussed in more detail, I encourage you to watch the kind of unabridged version of this video. And yeah, that's it. I thank you for your time, and I hope you have found this video to be interesting.